Welcome to the Lippincott Medical Surgical Nursing video series. Today's topic, caring for a patient with a possible myocardial infarction. In this module, you'll learn what's involved in caring for a patient who may have had a heart-related incident and how to deal with common patient questions and concerns. We'll begin with the report you receive from the nurse who's going off duty. The summary report you'll hear today is in the SBAR method: situation, background, assessment, and recommendations.
So you're the next nurse for Mr. Van Welden, right?
Yes, I am.
Are you ready for the report?
Let's go.
Okay. The patient is Charles Van Welden. He's a 55-year-old male with no known drug allergies. He's a patient of Dr. Wright, and he was admitted last night to rule out a myocardial infarct. Mr. Van Welden came to the ER after experiencing chest pain during intercourse. He attributed the chest pain to indigestion caused by a spicy dinner, spaghetti with sausage. But his wife became worried when the chest pain didn't subside. Mr. Van Welden did not want to come here, and you'll find out he does not want to be here now. But his wife insisted that they come.
And what did you find out in the ER?
Well, he was given sublingual nitroglycerin for the chest pain with relief after the second dose. His EKG showed normal sinus rhythm at 80, and there was no evidence of an infarct. His chest x-ray was also normal. His first set of cardiac enzymes was drawn at 11 p.m., and the results were within normal limits. The plan is to observe him overnight and check his next two sets of cardiac enzymes. If everything looks okay, Dr. Wright says he'll release him later today.
And what about his past medical history?
Appendix removal at age 10. Smokes a full pack of cigarettes a day and drinks socially on the weekends. Prior to admission, he wasn't on any medications at all. When he came into the ER, his vital signs were temperature 98.4, blood pressure 145/90, heart rate 80, respiration 16, pulse ox 97% on room air. He was ultimately admitted to the telemetry unit for observation, and he was put on these medications: aspirin, 325 milligrams daily, metoprolol, 25 milligrams every 12 hours, Docusate, 100 milligrams every 12, nitropaced, half-inch every 6 hours, and omeprazole, 20 milligrams daily. Here's his systems assessment. Neurologic, he is awake, alert, and oriented ×3. He was very anxious and not happy about being on complete bed rest. Cardiovascular, he is in normal sinus rhythm with a heart rate in the 70s. He has an IV site in his left hand, and they drew his second set of cardiac enzymes at 7 a.m. Respiratory, lungs are clear to auscultation. He is on room air. Gastrointestinal, his abdomen is soft and non-tender. He had a bowel movement yesterday morning and can have a cardiac diet this morning for breakfast. Genitourinary, he is voiding in the urinal without difficulty. Integument, his skin is clean, dry, and intact.
Okay. What are your recommendations?
Well, for today, he needs to be educated on all of his medications since he wasn't on any medication prior to coming into the hospital. Remember to check his cardiac enzymes that were drawn at 7 a.m. And he is very anxious. So make sure you explain what you are doing. Rationales really seem to help him.
Okay. Anything else?
Yeah. Have a good day.
You too.
Thank you. See you later.
You're about to watch a registered nurse conduct a focused assessment of a patient with a possible myocardial infarction. Note how she performs each step and, just as important, how she explains what she's doing to help the patient understand what's being done and why.
Doctor statement, please. Michael Crawford, 340. Michael Crawford, please call 340. Dr. Bruce, telephone, please. Dr. Bruce.
Good morning, Mr. Van Welden. I'm Grace Kim, your nurse today. How are you feeling?
Fine. I just need to remove the IV and unhook me from this monitor here, and then I can go home.
Sounds like you want to get out of here.
You bet.
Okay. Well, can we talk about this?
All right.
I'm just going to wash my hands. Here, let me help you with that.
Look, last night they told me that my EKG and blood work were fine and they just needed to observe me overnight. Well, night's done, daylight's here, I'm feeling fine, so it's time for me to go.
Okay, I'm glad you're feeling strong. And yes, it's true, they placed you under observation. But the doctor needs 3 sets of cardiac enzymes to rule out any cardiac damage. And the blood work they just drew from you was for the 2nd set. Plus, you still need to see the cardiologist this morning. So let's get you back in bed because we don't want to put any more strain on your heart until we know for sure that everything is fine.
Well, I don't see why I can't go home now, but okay.
Okay. All right. First, I have to do an assessment. That's a requirement, standard healthcare procedure.
In the military, we call it standard operating procedure.
So you understand that we have to follow a certain protocol. Here, let me check your ID band. Can you state your full name and your date of birth, please?
Charles Van Welden, February 1st, 1954.
Are you allergic to anything?
Just hospitals.
Okay. Now I'm going to take your vital signs. We'll start with your temperature. Under the tongue. .5, that's fine. Now I'm going to take your blood pressure. This will feel a little tight. Okay. (138/88). Okay, and the heart monitor tells us your heart rate is 75 in normal sinus rhythm, and your respiratory rate is 16. That's excellent. Okay, now your pulse ox. I'm just going to put this clip on your finger. It'll tell us how much oxygen your blood is carrying. %. Excellent. Your tissues are getting plenty of oxygen. Mr. Van Welden, are you experiencing any pain or discomfort?
Why? So you can keep me here?
No, because pain could be a sign that your heart isn't getting enough oxygen. You wouldn't want us to overlook that, would you?
No, I guess not.
Okay, so tell me, really, are you experiencing any pain or discomfort in your chest?
Mm-mm.
Neck?
No.
Jaw? Arm?
No, I'm fine.
How about your stomach? Are you having any indigestion or nausea?
Well, I haven't eaten anything today, so I'm definitely not feeling any indigestion.
Okay, well, if you do feel any of these discomforts, please let me know immediately.
Don't worry, I will.
Okay, for my next assessment, I'm going to listen to your heart.
If you have to.
When performing a cardiac assessment, listen to the 5 areas of the heart, checking for any abnormal heart sounds. Be sure to document the heart rate and rhythm after your assessment and notify the doctor about any abnormal heart sounds.
I'm going to have to listen to your heart under your gown, okay? I'll close the door for privacy. Can you turn to your left for me, please? That way I can listen to your heart from a different angle. Thank you. I'm going to pull this up and reach under.
Asking the patient to turn to his left side, if possible, makes it easier for you to hear any abnormal sounds.
Okay, you can relax. All right, Mr. Van Welden, your heart rate sounds regular, and I didn't hear any unusual sounds.
So my heart checks out okay?
For this, yes, but we still have to wait for the lab work to come back and speak to Dr. Wright about this. All right, well, let's listen to your lungs. First, I'll listen to the front and then the back.
Okay.
When performing a respiratory assessment, listen for any abnormal lung sounds, but pay particular attention for rales or crackles. These are a sign of fluid overload.
If you can take several deep breaths through your mouth. Again. Okay, the other side. Inhale. And at the other side. Inhale. Can you lean forward for me, please? Thank you. Inhale. Again. Again. And once more. Okay. Good. Well, your lungs sound fine, and I'll check them occasionally during the day.
Okay.
Okay, next I'm going to listen to your stomach.
Well, it'll tell you that I haven't had breakfast yet, but do what you have to do.
I'm going to have to check it under your gown. Is that okay? Mm-hmm. Okay. Sounds good. Now, tell me if you feel any pain or discomfort.
No, feels fine.
Okay. Now I'm going to look at your IV site.
When assessing the IV site, check for redness, edema, or drainage. Any of these findings is an indication that the IV site should be changed.
Do you feel any pain or discomfort here?
No, that feels fine too.
Okay. Well, if you do, please let us know.
Don't worry, I will.
I understand that you weren't taking any medications prior to coming to the hospital. That's good. But the doctor has ordered some medications for you, and I'd like to talk with you about them before I bring them in to you.
Thanks, I'd like that.
All right, well, first you're going to get aspirin, and this is for preventative measures.
Just everyday aspirin?
Yes, aspirin can help prevent a heart attack if taken on a daily basis. And it can also help decrease the potential severity of a heart attack.
Well, I'd heard that before, but I didn't think it pertained to me.
Are you okay with aspirin?
Sure.
Okay. Another medication you'll be taking is Myocardial. It's a beta blocker. It lowers your heart rate and blood pressure, ultimately reducing the stress on your heart.
So my blood pressure was a little high, I take it?
It could be a little lower. But we just want to reduce the stress on your heart right now.
Yeah, well, less stress sounds good.
Well, that brings up the next medication that the doctor prescribed for you. It's a stool softener called Ducasate.
Now, what the heck does that have to do with my heart?
I know it sounds strange, but we don't want you to strain your heart when you move your bowels. If you strain or bear down, it can exert extra pressure on your heart, which we definitely want to avoid right now.
Now I get it. Anything else?
There are 2 more medications, nitropaced and omeprazole, but we could talk about them a little later. There's no need to overwhelm you with all this information right now.
Yeah, that's probably a good idea.
Well, when I come back, I could bring some information and some materials for you to take home.
Okay, I can look them over later.
Okay.
So when did you say I could get out of here?
I know you're anxious to leave, Mr. Van Welden, but it's best if you sit and rest for now.
Okay.
Okay. Well, I'll be back soon. I'm going to go check on your lab work, but if there's anything you need, please let me know. Can you reach your call bell okay?
Yeah, it's right here within reach.
Good.
After completing your assessment, you will return all of the equipment and promote good infection control practice by washing your hands. When compiling your report, keep in mind that by noting trends from one assessment to the next, you can provide helpful insights for the patient's care. Based on your assessments, the nursing diagnoses for this patient could include anxiety related to possible lifestyle changes, deficiency of information related to underlying disease and methods for avoiding complications, and potential for ineffective cardiac tissue perfusion. Thank you for watching this video on caring for a patient with a possible myocardial infarction. Be sure to also study the instructions in your textbook, and please review this presentation at any time to support your learning and patient care.